I'm originally from New York. I went to residency in Inspira and moved up to Boston to work for a few years, and me and my wife always had a plan to come back to South Jersey. It's just an area we both like. The variety of work, really, I really enjoy that. Again, you can go from routine care to the operating room to do really any procedure, between limb salvage to reconstructions and implants, and it's a very variable field, which I really enjoy. It's hard to get bored with it. I'd say probably most frequently we do wound care, but we see everything from ingrown nails to any orthopedic condition where you need an implant, a joint fusion. Anything below the knee, we see it all. Your foot is really your foundation. So really keeping that healthy, whether you have a wound or you have an arthritic condition or pain. If you can't walk, it really affects every single day of your life. Every step you take, it could be agony. So trying to keep that healthy is fairly important. Putting the patient in the driver's seat, they're the real decision makers. I'm here to advise them, let them know about their diagnosis and treatment options, but in the end, they're the ones that really have to decide what's the best treatment option for them at the right time.